Good morning, everybody. I'm Dr. PK from DrPKLyfe, and in this video, we're going to discuss about the meniscus tear. It's a very common knee injury seen in a sports player, gym enthusiast, and older adults alike. I'm going to cover what is meniscus, causes of meniscus tears, different types of tears, and conservative versus surgical approach. So I'm going to break it down in simple language. What is the meniscus? Inside each knee, there are two menisci. Medial meniscus is inner side and lateral meniscus is on outer side of the knee. Think of meniscus as a shock absorber and cushion between the thigh bone femur and shin bone tibia. It helps with the stability, smooth movement, and protecting knee cartilage. Causes of meniscus tear. Meniscus tears can happen in two main ways. One is traumatic, which happens in younger people playing sports, like a sudden twisting of the knee. A sport like football, basketball, cricket, squatting, lifting heavy weight, and things like that. And degenerative tears is seen in older adults, usually wear and tear with aging. Minor movements like getting up from chair can cause it, often associated with osteoarthritis. There are several types of meniscus tear, but I'm going to discuss 5 types mainly. And all the tears are not same. And depending on the tear, treatment is different. Horizontal tear is common in older adults and often degenerative in nature. And then second one is vertical or longitudinal tear, which runs along the length of meniscus, and it can progress to a buccal handle tear. So buccal handle tear is a large tear that flips inside the joint and can cause knee locking. So remember, if you're having a knee locking problem, most likely you got buccal handle tear. Radial tear is which starts from the inner edge. They're called radial tear and affects knee stability significantly. All of a sudden, your knee gives out on you. That indicates radial tear. Complex tear is a combination of multiple tear patterns and is only seen in people with long-standing degenerative changes. Symptoms: knee pain, especially after twisting, swelling, clicking, popping, knee locking or giving way, difficulty squatting or climbing stairs. Approach for treatment is conservative, which is non-surgical, and surgical. Most of the meniscus tear do not need surgery. Best option is rest and activity modification, ice and anti-inflammatory medicine, knee brace for short-term. Physical therapy is very important. And the purpose is to strengthen thigh muscles. Weight control to reduce knee load. Small, stable tears often heal well with this approach. Surgical option is only considered if you have persistent pain despite physical therapy for lasting for 2 months. Knee locking. Often knees locking, then you know that bucket handle tear is the reason. Or large unstable tears, young active patients. Arthroscopic surgery is called keyhole surgery. What they do, they stitch the tear. It's called meniscus repair. And sometime if it is bad and folded and knee buccal handle one, they do partial meniscotomy. They remove the torn part of meniscus. The goal is to preserve the meniscus as much as possible, because the more meniscus is removed, there is a more chance of developing early arthritis. Recovery and long-term look: physical therapy is essential after surgery. Most people return to normal activity in few weeks to months. Early diagnosis helps protect your knee for the long term. So knee pain is not normal aging. If pain, swelling, locking persists, you got to get it checked. Like it, share it, repost it, and subscribe Dr. PK Life. Thank you for watching. Stay active, stay informed, and stay healthy.